Hello, my name is Roxanne Luna, and today I will be presenting the teaching strategy of reflection. My reference group are nursing students, and the setting is a post-clinical conference where we will be discussing learning objectives for the day and whether or not these objectives were met. Our nursing students are Roland over here to my left.
Howdy.
And Marcel to my right.
Hello.
Are we ready, guys?
Sure.
Absolutely.
All right. Roland, we'll start with you.
Sure.
What was your personal learning objective for today?
Well, today I had one goal, and that was to actually start and have a successful IV.
Oh, great
inserted
topic.
into a patient. Yeah.
Great. Can you share your experience with us and whether or not you were able to meet this objective?
Sure. When I got to the hospital this morning, I actually told my nursing preceptor that was my objective, was to go ahead and start an IV. And so what she did was she let all the other nurses know that if they had a patient that needed an IV started, to contact me to let me know. So I spent most of my day doing the normal routine, patient care, hand out medicines, things like that. And then finally, about an hour before the shift change, I actually got the call. And there was one patient that needed an IV started, so I grabbed all of my supplies. I grabbed my IV starter kit, the 20 gauge, the saline flushes, and also my IV extension kit. I grabbed my supplies and I went into the room. When I got to the room, I noticed that it was an 89-year-old gentleman who had been brought in for dehydration. Now, I did ask him if it was okay for me to start his IV, and he did allow me to. So I searched and searched and searched for a vein. Finally, I found one here on his forearm. So what I did was I went in and I cleansed the area with a chlorhexidine prep, and then I went ahead and I proceeded to insert the IV catheter. Now, I was able to obtain some flashback when I punctured the vein, so then I advanced the needle all the way through and then released the needle. I hooked the IV extension kit to the catheter and got the saline so I could flush it. That's when it happened. Even though I was flushing very carefully, somehow I was able to blow his vein. And I was so disappointed because of that. So I asked him, if I could do another vein, and he politely told me no. And I don't blame the guy. And I probably wouldn't have allowed me to do it either, but he did have his regular nurse go ahead and do it, and I did watch her do it, and she was able to insert his IV without any problems.
Oh, good. What would you do differently next time?
Well, one of the things that I did notice when she was doing it was she had advanced the needle about halfway through, and then she released the needle, and then continued to advance the catheter. And so she informed me that actually reduces the chances of blowing the veins. So I think I'll definitely take her advice and try that next time.
Oh, well, that's good. And Rowan, don't beat yourself up about it. It happens to the best of us. I mean, I've been a nurse for a long time, and I can't tell you how many IVs that I've missed. So, it does happen. Good thing is you're able to watch your preceptor do it, the IV insertion, and you're going to learn from that, and you took that and you're going to apply it to your next experience, which is good. So great.
I'm confident that I'll get it next time. I mean, I'm just so disappointed, but
That's okay.
I'll get it.
Don't worry, you'll be fine, I'm sure.
Okay.
All right, Marcel, you want to tell me about your personal objective for today?
Yes, my personal learning objective today was discharge instructions for a patient. And I'm so very excited because when I talked to my preceptor, she informed me that today should be a really good day to get discharge instructions from a patient. So we had one patient who had congestive heart failure, and that was his diagnosis. So I went in there and read him his instructions, talked to him, and confidently, talked to him about his discharge. So we went over it, and it worked out really well. And previously, I had watched another nurse do it, so I felt really confident in my skills, and everything went really smoothly.
Oh, good. Sounds like you had a good time with him, giving him that education. Is there anything you think you could do differently next time to improve on your experience?
It's funny you should ask that because I was thinking about it, and I think that next time I will ask him or her to give me a list of their signs and symptoms and have them read it back to me so that way we can be on the same page.
That's a great thing, Marcel, because a lot of times when somebody repeats, what you just said back, that that shows you that they understood and heard what you said, and it allows the patient to retain better and understand what you had said as well. So great job there. And you guys have any questions for anybody?
I think I'm good.
No? Okay. Well, thank you guys for coming today and talking about your clinical experiences. We'll be meeting again next week, so make sure you guys have your objectives ready for the next clinical, and I'll see you back in a week.
Awesome.
Great. Thank you.